Deborah Bird. I am a LPN and I work with Dr. Harvey, the medical director.
My name is Sunshine. I am the psychiatric RN here at Oklahoma City Indian Clinic. I work in behavioral health with the psychiatrists.
My name is Monica McKee and I'm the Director of Patient Services at the Oklahoma City Indian Clinic.
Kathy Waller, and I am a dietitian, registered dietitian, and I'm also a certified what we used to be called a certified diabetes educator, but now we're called certified diabetes care and education specialist. So I had to stop and think for a minute on my new title. I like the new title because of the word care.
I am Muskogee.
I'm a member of the Cherokee Nation.
I have been an employee 3 years now.
I began working here in December of 2020.
14 years. The first 10 years of my career here was chairside in the dental department, and now I serve on the administrative side.
I have been at the clinic for 21 years.
I got my degree from Platt College.
I got my first RN degree at Oklahoma City Community College, and I got my bachelor's in nursing at OU.
I have received both of my degrees at the University of Oklahoma.
I'm a proud graduate of University of Oklahoma.
I chose healthcare because I love being able to help others.
I was inspired by my experience in IHS. It was my first hospitalization, and it was just the best experience I ever had. All the nursing staff was so excellent. They were so excellent, and they just really inspired me to become a nurse.
My passion for healthcare stemmed from childhood. I've always had a unique drive to help people and to fix people, and if someone had an injury or an illness or a heartache, I wanted to fix it.
I worked with Oklahoma City Public Schools in child nutrition services for a number of years, and my heart was, I really felt a calling to be a registered dietitian because I cared about the children and their health and healthy eating.
Patient interaction. I love dealing with people.
We're a growing team. Psychiatry is expanding. We spent the last 22 years at OKCIC with only one psychiatrist, and now we have 3, and it's just a big growing team, and it's exciting to be a part of that.
Reducing barriers, taking something that has forever been a no and turning it into a yes, and helping bring services to the Oklahoma City Indian Clinic that we have been longing for.
Oh, my favorite part of the job is helping patients and being with patients and seeing patients and interacting with them and helping them to make healthier choices, or just making sure that they get all of their standards of care under the diabetes standards of care that they deserve. And that is truly my favorite part of the job.
I think equality. Everybody should be treated equal.
Access to mental health care is really important, equally important as physical health care, and so I just like to advocate for that and work towards that.
Bringing services here to the Oklahoma City Indian Clinic that we haven't had, and 14 years ago when I started here at the clinic, there were services that we just could not provide. If you needed a tooth extracted, we couldn't replace it. If you needed a crown on a tooth, we couldn't do it. And we were a culture of no. And something I have been passionate about is bringing those services and raising funds and seeking grant funding to make it available to where we can actually bring these services to our patients.
Just making sure that our patients receive the very best care that we have to offer. And we have tremendous programs here at Oklahoma City Indian Clinic, health programs at our wellness center and with our demonstration kitchen, our diabetes prevention program, our diabetes education programs. We have wonderful programs, and I want to talk to every person to make sure that they know about our programs and that they receive any information that they need or want.
Never give up.
A piece of advice I like to give to my patients is in psychiatry is that if you are having issues, that if you just reach out to us, let us know. You can call us or email us, and if we don't know, we can't help you. So if you could just report that to us, then we can help.
To not take a no as a no is the best piece of advice that I have received. So when you are faced with an answer of no, rather than giving up, it's kind of being more creative and finding a way to not give up on that and to get what is needed.
To fulfill your potential, never think it's too late to go back to school or do anything that you want to do.
My children.
Connection, finding a way to connect with whomever I interact with at work, patients, and just people in general out in public.
The most important thing in my life is family and our community, and I think that's what we all are here fighting for.
My family, and my family here at the clinic. I consider them my family too, and that's one of the reasons I'm still here and that I haven't retired, is because I just feel so close to everyone and they are my family.